Hi, I am Dr. Victoria West. I am a chiropractor at Functional Strength and Therapy. Today I'm going to be doing a video about diaphragmatic breathing and core activation. So I'm going to run through that with you. You're welcome to follow along. You're going to start by finding a nice firm surface, so preferably the floor, yoga mat on the floor, something firm, preferably not a bed, but it can be done on the bed. If you're in a lot of pain, you're gonna prop up your head and neck with pillows so that your neck is in like a nice comfortable state. If you're laying flat on the ground and you feel like you're getting a lot of like tension through like the front of your neck and shoulders, then I want you to prop yourself up on 1 or 2 pillows. In Chelsea's case, we use 2 pillows to make sure that she's nice and comfortable. Chelsea works at a desk, so that usually plays a role in that. We're going to have both knees bent. Just sometimes when the legs are straight, we can kind of feel like a little bit of tension through the front of the pelvis. So we're just going to bend those guys up. You can have them leaning on each other to start. You can put pillows underneath here. You can put a coffee table, something like that. But basically, I want everything above this part of your rib cage to be at ease and everything below your pelvis here to also be relaxed. You're going to just take a couple just gentle breaths, check into how you are breathing. Is your breath expanding through here? Is it coming up through the chest? Chelsea, do you mind doing a chest breath for me? Yeah. So what we see in a chest breath is that the chest bone, the sternum, comes up towards the chin, the angle of the clavicle increases, and we see that this, the front of the rib cage is really noticeable at the front. So that is a chest breath. We're going to be shifting into diaphragmatic breathing. So I'm going to have Chelsea I'm going to have my hand just at the back of her rib cage, so just kind of on the other side of this area. I'm going to have her press down into where my hand is, and you're going to see that definition of the lower rib cage decreases. So I don't want her to be using too many muscles to do this. So I want her to do this with as little effort as possible. So find it and then do a few breaths here. So I want to see between the rib cage and the pelvis expanding and pretty minimal movement at the top. For a regular everyday breath, I shouldn't see a lot happening through here. If you are exerting yourself, you will get that at the very end of your breath, but it shouldn't be there initially. I'm going to check in with Chelsea and say, hey, is this relaxed up through here? So we want the neck and shoulders to be relaxed. That includes your scalenes at the front of the neck. Everything should be at ease here. I'm watching when she's breathing to see if there's any activation at the front of the hips through the hip flexors. And so now that she's a few breaths in, we're seeing a little bit more activation and expansion between the rib cage and the pelvis. The oblique muscles sit like a corset around the body. And when we're inhaling, the diaphragm moves down, creating more pressure internally, which we see in the corset of those muscles expanding in a 360 range of motion. So if you were to hold onto a balloon, as you inhale, it should feel like all of the areas of the balloon are expanding. So I'm going to place my hand around Chelsea's midsection. So you have the hip bones here. My thumbs are going to be just on the front side of that. This part of my hand is going to be tucked in the side, and then my fingers are going to be tucked up underneath. So Chelsea can do this at home as well. So fingers are going to be here, web of the hand around the middle, and thumbs in the back. I'm going to have my hands here as well for feedback in today's session. So Chelsea, when you breathe in, I want you to feel the fingers move up towards the ceiling first. I want you to feel the webs of your hand expand out to the side. And I want you to feel your thumbs at the back getting pressed down towards the table as you do your nice inhale. Our daily breath should be reflective of this, and we should be able to feel all areas expand. It does take time for the diaphragm to strengthen, to be able to reach particularly that back area. So not on your back muscles, just kind of off the side, this kind of back part of the abdomen, especially if you are a heavily dominant chest breather. Comes often with anxiety, depression, conditions like that, where we've really fallen into a pattern of using the chest to breathe more often than not. So this may take a little bit of time to really feel that all of those areas are expanding. I encourage patients to take time practicing on the floor to do this. That being said, we can do it in standing positions, sitting positions at our desk when we're driving, obviously not with our hands, but just checking into making sure that these areas are expanding in our neck and shoulders and our hips are relaxed. So comment if you have any questions. I'd love to hear any questions that you have and do further videos on those things. So thank you very much for watching.